Hi, this is Paul Wise and welcome to the Lawn Vets video series. In this short video I'll be sharing with you information relating to bladder disease in cats. The term feline lower urinary tract disease, FLUTD, refers to several conditions that can affect your cat's urinary bladder and or their urethra. Because these disorders present with very similar clinical signs, additional diagnostic tests are generally needed in order to arrive at definitive diagnosis. Which cats are most at risk of FLUTD? Well, FLUTD is thought to affect around 1 to 3% of cats each year, so it's among the more common diseases seen. Because of the diverse nature of the underlying causes, cats of any age, breed and gender can be affected by FLUTD. But in general, the disease is more common in middle-aged cats, neuter cats, overweight cats, cats who take little exercise, cats with little or no access to the outside, and cats that tend to eat dry diets. Common clinical signs. Well, common clinical signs with cats with FLUTD usually present with one or more of the following range of signs. Difficulty or painful urination. Your cat may strain to pass urine and may sometimes cry out if it is painful. An increased frequency of urination. Infection and inflammation of the bladder and urethra will cause irritation and the increase in the desire to urinate more frequently. Blood in the urine. This can also occur with infections and inflammation. Blood in the urine may be microscopic, only detectable by us if we're doing a urinalysis using a dipstick test, or it may be more severe and you may actually see a red discoloration of the urine. Sometimes they even pass something which looks like red wine. Also, urinating out of the litter box and in unusual or inappropriate places. This can happen because the pain, irritation, inflammation in the bladder or urethra causes an urgent need to urinate. And so your cat may not have time to get to the litter box or indeed go outside. Overgrooming. Because pain and irritation in the bladder and urethra, some cats may start to overgroom and lick around their perineum. This can be severe enough to cause loss of hair. We also see behavioural changes. Some cats may show only behavioural changes, such as loss of litter box training, aggression or irritation. Lastly, and sadly most seriously, blockage to the urethra. Cats will strain to urinate and try to pass urine, but will be unable to. This is seen mainly in male cats, as the urethras are longer, narrower and more tortuous than in females, and so therefore more likely to become blocked. In Swindon this appears to be quite a common problem. If it occurs, it should be treated as an emergency and your cat needs to be brought to us straight away. Common causes of FLUTD. Firstly, feline idiopathic cystitis. This is the most common cause of FLUTD in cats under 10 years of age. The term idiopathic means that the exact cause of the condition still remains unknown, and it continues to be a diagnosis of exclusion after ruling out all other possibilities. Urethral obstruction. This condition occurs when either a urolith, which is a bladder stone, or a urethral plug lodges in the urethra, preventing your cat from passing urine, and it constitutes, as I said, a medical emergency. The most common stones which we see are the struvite stone and calcium oxalate stones. Urethral plugs. These are a combination of crystals such as struvite and a protein or cellular material that blocks your cat's urethra. Urinary tract infections, bacterial infections, tend to be seen in cats 10 years of age and older, and are in fact relatively uncommon in younger cats. We also see anatomical defects. Injuries to the urethra can cause fibrous tissue, resulting in the cat's urethra becoming strictured or too narrow, making urination difficult. And lastly, cancer. Fortunately, tumours of the urinary bladder are rare in a cat, though I have encountered cases. So, how do we investigate this? Common diagnostic tests will include, for example, complete urinalysis. The first thing we're likely to want to do is obtain a urine sample from your cat in order to run several different tests. Depending on the nature of the test that we want to perform, we may either want to collect a sample naturally voided, or if possible we might want to take a sample by cystocentesis if we think urinary tract infection is causing your cat's symptoms. Blood tests along with the previously mentioned urinalysis can provide very important information regarding your cat's overall health and help moving the diagnosis forward. Also, if we are thinking about having to investigate further and image the bladder and kidneys under general anaesthesia, it is very useful. Talking of imaging, the imaging modalities which we tend to deploy are X-rays or ultrasound. Both have their advantages and disadvantages. How do we treat the condition? Treatment of FLUTD will depend on the underlying cause. If your cat does not have a blockage of the urethra, it will probably be managed on an outpatient basis, although a diagnostic evaluation may require a brief period of hospitalisation for blood and urine samples to be obtained. If, on the other hand, your cat does have a blockage in its urethra, then this is of course an emergency, as the kidneys will start to shut down and there's in fact the danger of bladder rupture. Most likely we will need to hospitalise them for an emergency catheterisation to unblock the urethra and relieve the obstruction, moving on to obtain a diagnosis and go on to manage the problem. In general, how do we manage it? Well, increasing water intake and encouraging more frequent urination are all good objectives in case of FLUTD. This may be helped by feeding wet, either tinned or sachet foods, rather than dry foods. Although, having said that, where appropriate, a dry prescription diet will often outperform a wet standard food. Encouraging drinking and correcting obesity, and encouraging exercise and encouraging urination by considering how best to use litter boxes are also very useful things to do. As always, if having watched this video you have any questions or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video would be very much appreciated.